Dear viewers, I hope you are all fine. This ultrasound video shows a case of pyonephritis associated with pyoureter and ureteric stone. The patient is aged about 15 years, a male child. Pyonephritis is defined as infected hydronephrosis complicated by infectious destruction of renal parenchyma or the presence of pus in dilated bilocalcial. Pyelonephritis is a kidney infection usually caused by bacteria that have traveled to the kidney from the infection of the urinary bladder. Women have more bladder infection, also called urinary tract infections, than men because the distance to the bladder from skin where bacteria normally live is quite short and direct. You can see the left kidney and pelvical ciliary system is grossly dilated and a significant amount of pus, debris and infectious material is seen inside the dilated pelvical ciliary system. Now this is the kidney, left kidney, and you will see the tracing of the ureter. This is the pus or sludge seen in the dilated pelvical ciliary system. Now the difference between pyonephrosis and pyelonephritis. Signs and symptoms of acute kidney failure may include decreased urinary output, although occasionally urine output remains normal, fluid retention causing swelling in the legs, ankles or feet, shortness of breath. Now you can see clearly the debris, sludge and pus. So this is pyonephritis. When kidneys are failing, the increased concentration and accumulation of substances in urine lead to a darker color, which may be brown, red, or purple. The color change is due to abnormal protein or sugar, high level of red and white blood cells, and high number of tube-shaped particles called cellular costs. You can see the urinary bladder is full of sludge, thick sludge. Now, about 20% of patients do not have bladder symptoms, and some patients do not have fever. So, the clinical presentation and disease severity vary widely from mild to flank pain with low grade or no fever to septic shock. Now you can see the tracing of the ureter, and the proximal portion of the ureter is filled with this pus or sludge. Pyonephrosis is characterized by accumulation of purulent debris and sediment in the renal pelvis and urinary collecting system. Now you can see a large amount of thick sludge and a large stone in the starting from the upper 1/3 of the ureter and extending into the middle portion of the ureter. So I don't think this is totally a stone. Sludge may also be present, but you had seen the sludge in the proximal portion of the ureter when there was no shadowing, and this portion of the stone and sludge is has a strong posterior accosting shadow. So this is the stone, and this stone measures about 50 millimeter. So pyonephrinosis is characterized by accumulation of purulent debris and sediment in the renal pelvis and urinary collecting system. Children with pyonephritis have symptoms similar to those of acute pyelonephritis, but frequently symptoms are more severe or persistent, and there are additional signs of hydronephrosis. You can see the difference. This is the sludge, and this is the stone. Thanks for watching. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.